Hey everyone! So, we are going to be talking about the pelvic floor and the return to exercise postpartum, specifically high impact exercise, including running, lifting, HIIT, spin, whatever it is that you do that's considered to be high impact. That's what we're going to be talking about today with Laura and I. So we'll get Laura on here with me, and then we will get started. So definitely make sure that you send us your questions, because this is very specific to each individual person. Lots of different people have different questions in different specific situations. And so hopefully you can send us your questions and we'll be able to answer them. Hi, Laura.
Hey,
How are you?
good. How's it going?
Good. Yeah.
All right. Everybody up to speed?
Yeah, on what we're talking about. So, yeah, we can definitely get started.
Okay. Did we have any questions to start with, or do we want to just kind of talk about pelvic floor and some of the more high intensity
Um,
moves to
I
start
think
with?
kind of with the basics of like returning to movement postpartum, and then like more specific questions. I think that probably makes the most sense.
Okay. So we kind of touched base on it quite a bit last time, but for those first few weeks, it's all about reconnection, connecting with the pelvic floor and that inner core, and just bringing the abdominal wall in together and reestablishing that. And that this time is perfect to be checking in with your breath and checking in with your posture. Because once you are kind of, you hit that 6-week mark, you're able to start advancing, doing a little bit more exercise. You want to have the foundational skills already there. So that's the perfect time to be practicing it, because you need to be squatting down and bending down to pick up the baby and to do all those things. So you want to make sure that you have already been practicing that and have a good foundation. So then when you do jump into some exercises, you don't have to waste time doing that, and that you've been protecting yourself during your daily activities already. I think one of the biggest things that I like for people to really like sink in is the fact that when you're exercising, you can't just squeeze it and make it work better. So especially with like a lift, you certainly can brace and like plan that out. But if you're doing something that's going to be repetitive, like running or high knees or like, some sort of cardio activity, you need to be able to have a connection with your pelvic floor and trust that it's going to do what it needs to do when you're doing something like that. If you go and run and you try to squeeze your quad the whole time and contract it, you're not going to get very far, because it needs to lengthen and contract, and it needs that reciprocal motion. Same thing with the pelvic floor. It needs to lengthen to prepare to receive that impact. So when there was a study done, and it was pretty interesting, because they did a study with a monitor in the pelvic floor, and it basically assessed what the muscle activity was in the pelvic floor when the person was like heel striking, when they're landing with running. And the monitor showed increased activity right before heel strike. So at first, we thought that study was indicating that the pelvic floor muscles contract before heel strike. They contract to prepare for that impact.
Mm-hmm.
But then, we started kind of thinking a little bit about it, because we know that it doesn't necessarily test if it's shortening contraction, because the pelvic floor muscles can like squeeze and lift to do a contraction, and they can
Right.
let that go down to rest, and then they can lengthen for a contraction. So that activity, that active lengthening, is activity in the muscle. So they
Mhm.
went back and did the test with the same monitor of how much muscle activity was happening, and they also did a sensor of where the sensor was in the pelvic floor. So the sensor's in the pelvic floor, and they found that the sensor was lower right before heel strike. So it was indicating that the pelvic floor was lengthening. It was actively lengthening. So we had that activity that they picked up on, but it was going down in order to prepare to contract and support. So it's all that different direction. And so the pelvic floor needs to be able to lengthen to have a more optimal contraction. So just squeezing it isn't going to work, and you're going to be frustrated because you're still going to be leaking even though you're squeezing it. So being able to have, when you're not doing that activity, having a connection to be able to have good coordination in both directions, and then making sure like if you do tend to have a tight pelvic floor, before those activities, it's a good practice to do some lengthening breaths and release as much tension and get your resting tone down as much as possible going into it. And then you could, hopefully get more miles out of what activity it is that you're doing.
Yeah, absolutely. That's great advice. Definitely.
And then another big thing is, so we're thinking about, involving the pelvic floor, involving the core, and making sure everything's engaged, and using the breath for that, and using our posture to make sure that the muscles are accessible. So that's a whole bunch of stuff that we're kind of bringing to the table to make things more optimal, but then also looking at our pressure management. So pressure from above in our abdominal space. So how are we breathing? How are we guarding? Are we pushing out into our belly? Are we pushing down onto the pelvic floor? And then the pressure from below. So how are we landing? Are we back and heavy on our heels? Are we forward and light on our forefoot? Are we tucking under and bracing when we have that impact for a split second? So looking at all those moving components, which is all the beautiful things that you are doing behind the scenes.
It's almost like your nervous system reaction, like, is your body like ready for it? And if you're like, before you're running or if you're doing any of your exercises, then you're not going to be optimally functioning. So that makes total sense.
Yeah. And I don't know if this happened to you. Like, I was not a great runner by any means, but I did run track. And I always, I had those nerves, and I always had, like, I would go to the bathroom, and then as soon as I got out there, I had to pee again. I didn't really, it was the pelvic floor tightness and the anxiety and the stress of the situation that was giving me those symptoms. And even though you just peed, there's always a little bit in the bladder, so you still can get leakage, even if, if those muscles are tense and then they spasm and release, you can still experience that.
Yeah, absolutely. Yeah, I definitely had that when I was in high school, like right before races. I was like so nervous, and you're all like, oh my gosh, what's this going to be like? And then I'm like, oh my God, I have to pee again. And I never made that connection. And it's funny because I'm pretty sure because I was a sprinter in college, and I think I continued that issue through college. But then I guess now, but I don't experience that with lifting because I don't run anymore. And I certainly don't run in races. But yeah, it's to me, I think like lifting is like a little bit more of a controlled environment. And I think that's why I liked it a little bit more. I felt like I could sort of control, like, what I was doing, how my pelvic floor was responding. I could tune in a little bit more with my body, which is why I love the weight training for all my female clients, but very specifically for my postpartum clients as well, because I feel like it's very controllable, and it's also extremely functional because you're doing it every day anyway. It's like, you're talking about earlier about practicing things before you actually get to the 6-week mark, because let's face it, how many times in a night are we getting up and having to like reach over a crib, or, to like lean over to nurse or to bottle feed, whatever you're doing, you kind of do these things and you don't even think about it. But in order for them to get better when you're not thinking about them, you have to think about them first, make them part of your routine and part of that movement pattern that your body automatically goes to. And then you'll do these things when you're not thinking about them, as opposed to like, bending over to pick up your baby and you're like, ow, my back. And you're like, oh no, I did that really badly. So you can't expect in the moment that you're going to be like, and hinge. Yeah. And breathe. Like, you're just not going to do that if you don't practice that. So that's why, to me, we definitely encourage our postpartum clients to to come back to exercise, even if it's like less frequently, even if it's remotely. Just doing some type of movement on a regular basis is so helpful in preventing injuries, because let's face it, like,
Yeah.
who has time for an injury? I certainly do not have time for an injury.
No, yeah, you have to get moving, and the more you wait or you feel fearful and you avoid, it just makes it more challenging. And you'll get better quicker if you load the tissue. The tissue is going to get stronger. It's going to regenerate. It's going to heal better if you challenge it responsibly, though. Within, like Anthony Lowe says, within your borders. Find your borders. And work there and get good at that and then progress. But if you find a comfort zone and you stay there, like with anything, even if it's, without injury or if you just keep lifting those same 5-pound weights in the same way, you're not gonna, first of all, your brain doesn't care about that. So it's not going to carry over and change. And you're never going to challenge yourself enough to make any changes.
No, exactly. And sometimes, I mean, some people have the motivation and have kind of the wherewithal to be doing things like that at home. And then other people don't necessarily have that. And other people need like that kind of one-on-one guidance, or like a guidance within a small group. And so that's why, I think it's even really helpful when you're earlier postpartum to get into a group environment and to feel like, okay, I'm not the only one who's where I'm at right now. So like that's a benefit of doing our like early postpartum program, or to coming to see you on an individual basis. Like, it's okay for you to do this, and like, here's how you can progress, and here's how you know when it's time to progress and time to move to kind of that next level to continue to challenge yourself. Because if you don't have someone telling you that, or you don't have someone guiding you, it is easy to fall into that comfort zone. Like, no, this is what I'm doing, and this is what I feel good with, and this is what I feel comfortable with, and this is what thing I have control over. And so I don't want to do anything else that pulls me outside that comfort zone. So it's definitely really important.
Yeah, figure out your baseline. Find out where you're at and what is safe, and how to safely progress. And that group support system is, I mean, even if you're just showing up to watch, or maybe you're doing something completely modified, it doesn't even look like what the other group is doing, but having that socialization and just that mental health component can be really great. But definitely, making sure that you understand what your body is ready for, and how to monitor it. So being able to see the signs. I mean, if you're leaking, it's a pretty big sign that you're going past your border. But there are other signs that maybe we can start to identify and listen to before we get to that point. Like with diastasis, if you've got maybe it's not causing you pain, or it's not restricting you in any other way, but being able to look to see if you have if you're starting to do compensatory techniques, or if you're having some doming. And that, I don't want to say doming, like, so doming is like between the muscle bellies. If as you come up, it kind of rounds and cones in the middle, along that midline area. And I don't want to say that that's necessarily dangerous or a bad thing, but just being aware of it and identifying if that is a safe pressure release for you or not. Is, I mean, why guess at it, right? Find out what's going on with your body, how your pelvic floor is progressing and healing, and what your body is able to tolerate, and build from there.
If we, why don't we address that a little bit and talk about diastasis, because it's a big point of contention among a lot of women who are postpartum. I have questions about it almost every class during pregnancy and postpartum, and otherwise. People who are maybe trying to conceive and are anticipating the issues. So diastasis, for people who don't know, is a separation of the rectus muscles, so the six-pack muscles that sit side by side. And so it's a separation, it's a stretching of the tissue that kind of holds all those things together. And now it's not necessarily, so I think a lot of times, like the kind of the traditionally held belief is like, if your muscles are sitting apart, then it's not a good thing. You're not going to function well. But how would you address the diastasis rehab, as far as like definitely diaphragmatic breathing, But then like, what are the next steps? So when you're kind of ready to like take that next step back into exercise, but you're like, I still have this separation, I can still feel the separation, whoever you're seeing, your therapist, still feels that separation, you know, how do you know that you're ready to return to exercises that are going to be challenging for your core muscles?
So one, a big check-in is, how does that person feel when they're doing that task? So, are they functional? Can they do what they want to do without symptoms, without pain, without leakage, without like any prolapse, like heaviness feeling in the pelvic area? Um, and then assessing, when they do whatever the task is, are they able to engage their core and engage their pelvic floor and breathe properly through it, or are they bearing down on their pelvic floor?
Mm-hmm.
So just seeing how their body is responding to it, because if they're able to manage all those things, and there's no threat on like downward pressure to the pelvic floor or on the pelvic organs, um there's nothing saying that that's a necessarily a bad thing. So especially like if you think of the two rectus abdominal muscles, the two six pack muscles that come down this way, and that linea alba, that middle connective tissue section between them. Um, it's not necessarily that we need those two muscle bellies to be tight and right next to each other, as long as we've got that fascial backing, that connective tissue in between them, strong. So, a lot we used to always go by measuring the distance between the muscle bellies. Now, I mean, I'll take note of it, but I won't necessarily care so much unless the client does. But I won't necessarily care so much that how close they're getting, but how does it feel in the middle? Is it soft and squishy? Can I get down and sink, or does it kind of bounce back and hold its firmness?
Right.
Um, and that's kind of more the integrity that you really want to be talking about, and really bringing it to the table to like to your client, that um you know it's not a bad thing that those muscles, I mean, those muscles probably, like, most of the times don't come all the way back in. um but it's really that integrity between them, and how your body is able to engage and interact. But then there are aesthetics. So sometimes people really just don't like the look of it, and then that's a different conversation that you're going to be having and addressing with them.
Yeah, absolutely. And I think it's also like a matter of time too, because I mean, initially postpartum, I mean, like basically everyone's going to have an abdominal separation, just because your body had to stretch, and those muscles really had to separate in order to house, you know, the baby in your uterus. I mean, there was a lot of going on in there, right? So you
Yeah.
had stretching and that separation. And I think that a lot of women like postpartum are like, oh my gosh, where do my muscles go? Like I have nothing left. And I hear it again, I have no core left. I have no core left. I'm like, that's not true. It's there. But just think about like a big, like think about an elastic band, like a rubber band that you're stretching and stretching and stretching and stretching. And then if you stretch it for a long time and you let it go, it's not going to pop right back into, you know, what it was before. It just isn't. But that doesn't necessarily mean that it's never going to, you know, regain its elasticity. It means that, you know, it has to be appropriate progress through your movements. So again, like first addressing your breathing, making sure that you're breathing well, making sure you're able to utilize your diaphragm, that you're able to breathe into your belly, that like 360-degree breath all the way around. Um, and then, and then like you're saying, like loading the tissues. So initially loading your tissues can be just with your body weight. So we can just be doing certain things that are challenging those muscles, to go from that shortened state, or sort of from the lengthened state down to the shortened state, like encouraging them to come back together. And like we spend probably about 25 minutes of the first early postpartum class just talking about breathing and like different breathing techniques that we can use in order to encourage everything to kind of come back down to normal. So then, you know, once you kind of set those foundational movements, then adding on more challenge. So doing things like hands and knees, like bird dog, and even things like bridge, and coordinating your breath when you're doing those things, so that you can encourage again like activity in your core, because you lose the connection with your core so much during pregnancy and then like postpartum. And then knowing when you're ready to throw in some weights, knowing when you're ready to hold weight at your side, when you're ready to hold a weight at your chest for a squat, and when you're ready to press overhead, because all these things involve the core muscles and involve in loading the tissues. So I think there's a lot to understanding that like there's going to be definitely like a really challenging time where you're like, I have no muscles left. And I'm like telling myself this right now at 35 and a half weeks.
Well, and it's hard too, because especially like you said, you have, you're pregnant, you have this big like tension. It's out here and you have it's tension. That's your stability is that tension. And then you pop that bubble and there's just nothing counter stabilizing
Yep.
in that space anymore. So connecting with the breath, being able to build those blocks, the early stages, and then and then loading them and strengthening them.
So is there a timeline that you recommend for returning to, like, say, for example, running? So kind of that sustained, do you kind of say like you can start sort of attempting to run around 6 weeks post or 12 weeks post, or is it very individual? Like what kind of
It's going to be an individual, but typically most of the research is showing that around that 6 week mark are most like there's still a lot of healing going on with the pelvic floor, and that like high impact repetitive motion is a little demanding at that mark. And then even at 12 weeks, there's still healing. So it really depends. But you typically, I think a general timeline around 12 weeks to be looking at reintroducing running. Now that being said, there are some tests that because some people do not want to wait that long. So then I kind of go through some tests and look at are they able to do some single leg stuff with good posture and without bearing down or without having symptoms? Are they able to do like a lunge and then progress them up to like a little mini hop lunge without breaking? Like, are they able to stabilize their pelvis? Are they able to keep the good pelvic posture and the rib posture and the breathing strategies? So there's a couple little tests that I'll run through, and then if they feel good with that, usually I'll have them with their walking. I'll have them make sure that they've been doing a good incline walk, because that tends to promote them getting forward and getting the rib cage over the pelvis. And will challenge their cardio, because that's another thing too. The breathing, if they can get practice the breathing, but then and then they can get that whole good core engagement, like just doing it, but then you add a cardio component that's demanding on the diaphragm in another way, then everything often will break down. So then being able to peel it back and add that cardio in where they can manage all the things, I say. And so like a good incline walk, and then make sure that there's no symptoms there. And then they can kind of start to build up that run tolerance.
Yeah, absolutely. And then would you say like, go out and run like a 5K or a 10K or on your first run?
Yeah, no, I mean, there's protocols out there. And usually I'll reference, and I can't even remember their names right now, from Ireland. But they came up with a really good kind of, return to run protocol, as far as like, how many minutes on and off and alternating and building that way.
Yep. Yeah, absolutely. I think there's definitely like, because you get to the point, I feel like postpartum, you get to this point where you're like, you haven't done anything, and then all of a sudden you're like, I have to do something right now. And you're like, I have someone watching baby, I'm going to go for a 10K.
All of it.
Over and over again. You're like, I just wanted to go, and I like wanted to have the time to myself. And it's like, okay, great. Go have the time to yourself. But also keep in the back of your mind that, if you go 0 to 60 in, 2 seconds, you're going to put yourself at risk for, not being ready for that. And we wouldn't recommend that for anyone who is running, or just starting out running, and especially not someone who's postpartum, but no one, there's a reason why they have the Couch to 5K programs, because they're manageable and they help to mitigate injury. So again, like, no one's got time to be injured. So that's a great, it's if you rate yourself down a plan, I think that's really helpful to say, okay, here's my plan. On this day I'm going to run, or this week I'm going to run for 3 days. and I'm going to run this distance, this distance, this distance, or it's I'm going to go 10 minutes, running straight and then 2 minutes walking and then another 10 minutes and then walking home, and then I'll be done. So it's kind of like making sure that you have something written down so that you're not just kind of like going on, just like a knee jerk reaction of like, oh, I have to go do something right now. Cause I feel like that happens a lot with
Yeah.
work too. Like they'll be like, okay, I have 20 minutes to work out. The baby's sleeping. I'm going to, go on YouTube and find like the, whatever HIIT workout I can find. I'm going to like sweat and I'm going to burn all these calories and I'm going to get all this.
Max intensity.
Yeah. And I think it's like, it's very tempting to like get into that, slip into that mental state of like, I just want to do this because I want to do it and I want to feel strong and I want to feel like myself again. And so previous self did all these things. And so therefore current self should be able to do that. And it's very hard to kind of like really get to the core of like, this is not necessarily the best thing for me right now. And it's like having support, whether it's a coach, whether it's, a therapist, whether it's a friend, to kind of like bring you back down to reality and like, hey, you know what? Like maybe you're not quite there yet. And like, that's okay. You're going to get there. It's just going to take a little while, right? Like everyone's individual. So I think, on that same line, when women go back to, say, for example, like weightlifting, what do you make like general recommendations, for returning to weightlifting, or is that again, like very individual?
Definitely individual. I'm glad that you say weightlifting. And I always like to specify that some people kind of get confused when you talk about weightlifting and we're talking about like a high intensity or high impact
Well, honestly, very
activities. So
combined.
it's what's that?
They're very much combined these days.
Yeah. Because I mean, you have a high impact, but
Right.
the weightlifting can be more controlled, but the pressure management is so important. You have to be very, very tuned into where you're loading and where your pressure is being displaced to. So it's an intense move, even though it is controlled and you can plan it out. But yeah, no, I mean, I like to start my any progressions kind of at basic. Start with lying down, the breath and the core engagement, then adding, if I'm doing a bridge, but then, as soon as that's easy, getting them up on their feet and doing different types of squats. And then for adding anything freestanding, I want to get them good at that. Okay. So no pelvic dips or rotations or breath holding or pushing out into the belly, and make sure that there's no pain or no symptoms like leaking or heaviness. And then when they can do that, then we can add in some weights. And then just make sure that whatever weight that we've added there, everything looks good. The posture is good. They're not tucking, they're not arching, they're not holding their breath, all those things.
What are some common like compensation patterns that you would see in functional movements, like for example squats, in a postnatal woman that she could look out for, that she could say, oh, I'm not quite ready for this amount of weight because my body's doing this?
Yeah. So let me see if I can stand up here without knocking everything over. Okay. So again, and this is just one pattern, but a very typical pattern. Let me take this off. A very typical pattern of postnatal is, so we've got the space, the baby we've kind of opened the pelvis is kind of opened a little bit and we've tucked under, and our rib cage is kind of splayed up. Okay.
Yep.
And a lot of times this is a very common pattern that we get left in and just aren't aware of it to be coming out of it. So the first thing is to be looking at getting the pelvis out of that tucked position.
Yep.
Okay. So getting it out of that tucked position and then getting the rib cage drawn down. So I talk about closing the bowls. So the pelvic bowl and the rib cage, make sure that they're lined up on top of each other and that they're neutral. So we don't want our headlights beaming up. We want them straight. And we don't want to be tucked or arched. Okay. And then we want them stacked. So a lot of times we find this upper back behind the pelvis. So making sure that that rib cage is over the pelvis. So with the squat, just finding that standing posture is the number one. And then if they're squatting down, so I'll start them off with a pole, so a broomstick or whatnot, have them in contact with the head, the upper back, and the sacrum. And just have them practice a hip hinge like this. Okay. And what I often see is one, either this pulls away, so they're rounding at the top of the back, or if they're really now focused on keeping the contact at the sacrum, they come down and they pull away at the, can you see that?
Yep.
They pull away at the upper back. So now they're arching to accommodate, or they're pulling away at the head. So this is just a good way to start feeling how it should feel to be able to have a nice hip hinge. I can keep this alignment. This doesn't change as I bend down. Okay.
Right.
So the movement comes from the hips. And then if they're really struggling with that, because if we're tucked under, our glutes and our hamstrings are probably tight.
Right.
Okay. Or our hip rotators are tight and our glutes just aren't doing their job. So we've got this. So it's short here. Let me see. So we're tight and we're short. So when we go to hinge at the hip, this doesn't want to let go. So that's why we get this upper back bending more.
Yep.
So getting the idea of lengthening here and receiving here and then shortening to come up. Okay. So just that visual and using their hands to be able to feel that this is lengthening and opening, and then feel that it's shortening to pull you up. And this should be where the work is coming from. Those are pretty common ones. And then that can translate into, how do I get down to the baby on the floor? How do I get down to pick up that load of laundry?
Yep. Yeah, I think, I see a lot of times postpartum that a lot of women have trouble keeping their torso upright when they squat versus when they're deadlifting and they're coming forward, because they don't have that deep core stability. So a lot of times, we'll see, that squat, and as you're coming down, your torso goes like this, and you're tipping over because you don't have.
So you're seeing this more.
Yep, and that's
rather than staying up. Yep,
exactly. And it definitely a correlation between people whose deep core muscles are not quite there, who are leaning forward, and whether that's compensation because their ankles are really tight, because they don't have the flexion necessary to get down, or whether their hips are tight, or whether it really is just like a matter of they can't keep their torso upright. So I see this a lot in like women who are not, I'm not just talking like weeks or months postnatal, I'm talking like years postpartum, who are still bending over to get into their squat. I'm like, no, we're missing this. There's a big difference between the squat and the hinge pattern. So when we're deadlifting, we are looking for that deep hinge through the hips. So you're looking for maximal flexion through your hips, so bending over, while keeping a neutral spine, but you're also allowing your torso to come forward. And then the squat is maximal hip and knee flexion, keeping an upright torso as much as possible. I mean, obviously you have to lean forward, a decent amount to allow for that movement. But the difference between the two things. And I've definitely, there's women who have come in that, so we do the wall hinge, which is really similar to what you just did. But using a wall as a point of reference, as opposed to like using a dowel or a stick. And I find that a lot of women are like, oh, this feels really good. It feels like my whole back is stretching. And I'm like, yep, you've been squatting this entire time instead of hinging. So like, there's definitely finding that difference between the hinge and the squat pattern it's like a really big part of our like postnatal kind of like finding that deep core and finding that position. How do you keep your spine in neutral? Because that's really at the end of the day, and we try to put this into perspective, that's really the most important role of the core, is to protect the spine. So that's like, it's your, your core, your entire torso, everything is, makes up your core. It's not just your six pack muscles that are, the aesthetically pleasing part. And so, but when you pay attention to the whole core, that's when you will, I think in my experience, will actually have success in building up those core muscles all the way around and avoiding that injury when you start to kind of see it as like a whole unit to protect your back.
Yeah. And a nice one to separate out the two with the hinge and the squat. Do you have your clients ever do the wall ball squats where they're kind of leaning back on a therapy ball on the wall and
Mm-hmm.
then they squat down? So that's a good way to just get that back leaning position
Yep.
and really feel what that feels like to be upright and squatting down, and then slowly progress them away from the wall. And I'll use a chair, just
Mm-hmm.
have the chair there. At first they can sit down on the chair and then stand up and practice that if they need to,
Yep.
but then have them just, the chair is really just there as a cue, and I'm going to sit down, because
Yep.
we don't sit down like this. So it's a good, just to kind of target to be
Right.
stayed upright and practice that way.
Yeah, exactly. And that's why, like, we practice mainly kettlebells at Her Strength. And, to keep that torso upright when you're holding a kettlebell in the goblet position at your chest, you have to really stay like
Yeah.
very, and when you're holding two kettlebells in like a double rack position, you have to stay upright. You can't tip over, because if you do tip over, the weight's going to pull you forward. And
Yeah.
so it's, you're kind of like, okay, you got to keep your back engaged and stay tall and think like, okay, knee hip flexion. Because I think a lot of people have been taught, never lead with your knees, when in actuality, that's not necessarily a bad advice. Like, yes, leading with your hips is the way to start, but if you have that hip and knee mobility, to lead with your knees through a squat is not necessarily a bad thing, as long as your hips are also following.
Yeah. Yeah. I mean, some people get so rigid and the knees can't move forward at all. And the
Right.
knees can move forward. We just want to be mindful of not allowing them to go too far forward beyond the toes.
Yeah. And I think, and also there's also like a difference between squatting to like a certain depth that's beneficial, and squatting to, you know, a depth where your pelvis can't hold that stability. So a lot of times we see, like the butt wink, we call it the butt wink, the little
Yep.
pelvis at the bottom squat. And so that basically, like, you can tell that you're doing that if you kind of stand side onto a mirror, you squat down, and then your butt tucks underneath. So you lose that neutral position of your lower back. And if you're losing that position, that can put undue pressure on your lumbar spine, which is where you don't want undue
Yeah.
pressure, because that's where we're going to see, most disc injuries over time. And so a lot of times I've seen, the issue with the butt wink is deep core stabilization and pelvic floor strength, and that like where the reflexive response from the pelvic floor. If you're not getting that, then you start to get that like pelvic tuck. For me, like that took me probably like over 2 years postpartum after my third to figure that out, because I was like, oh, I just have a really pronounced like lumbar curve. Like I still have that anterior pelvic tilt. I'm still tilting just because I had babies and that's how I'm always going to be. Well, it turned out, and this, I went to a barbell certification, and the guy who was leading the course was like a well-known, world-renowned power lifter, and he is like also a chiropractor, and so he's very familiar with like the anatomy of the female body. And he was like, so try these different techniques, try these different breathing techniques, and really try to like brace your core. And as soon as I figured out how to make that connection to brace my core, I stopped butt winking, I stopped tucking, and that anterior pelvic tilt went away, and it went to a normal state. And so I can imagine that, earlier postpartum, that would have been even more challenging for me to get. And so it's like, it's not skipping those baby steps in, getting back into strength training and not ignoring the compensation patterns that you're showing because you want to just get back into it.
Yeah, because we can do the things, right? We can
Absolutely.
find our way to be able to do it, but is it right for us in our
Right.
bodies, and is it going to serve us for the long term is really the question.
Yeah.
And I think, like especially when you talk about the core, so what we tend to do is we tend to grip under here to
Mm-hmm.
create stability for the pelvis. And instead of grip, and when we grip here, that's again that we end up getting that shortening and we get that tucking
Right.
under. And instead, like you're saying, bring it to stabilizing the pelvis from the top and front. Okay, engaging that core and getting that stable. So then these can lengthen and do their movement job and not tuck under and lock us into that position. A really good way to practice that is on hands and knees, and I have people do like a hip shift, like they're on hands and knees and they shift back into their hips. So
Rocking.
it's like they're sinking down, but they're on their hands and knees and they're shifting back. And I have them start sequencing the inhale for the lengthening and that receiving, and then the
Mhm.
exhales they shift back and that shortening phase. So it's not hard work. It actually should feel good, but you're laying that more automated pathway that you're looking for down the line. um, and you know a as they do that, as they shift back, making sure they only go as far back as they can without tucking under. So
Yep.
they're already starting, because I mean it's easy to shift back into a child's pose, but that's not what we're going for. And just like with a squat, we don't want to go so far down that we tuck under like that.
Yep.
So finding where you can go back to and work from there. Don't overdo it, and just have a goal and keep working towards that.
Yeah, we actually do. We do a lot of rocking, just like hands and knees rocking, and we definitely have, we pay a lot of attention to that neutral position of the spine. And I think a really great progression to that is learning how to contralaterally crawl. So from that hands and knees position, being able to lift the knees just slightly, like an inch off the floor, not like a bear crawl, like a leopard crawl. So like knees up just like half an inch, and being able to move opposite hand and foot at the
Yeah.
same without shifting through the pelvis. So we give like the analogy of like you're a leopard, you're in the jungle or whatever, and you're stalking your prey. You want to be moving as smooth as possible. And sometimes we'll even use like a yoga block or something on someone's back to make sure that they're not shifting and they're aware of like, oh, okay, so I really have to like brace my core in order to not shift through the pelvis when I'm doing this movement. And it can be really, really helpful in kind of gaining that awareness, because it's not necessarily an exercise that you can watch yourself do. It really has to be that intrinsic awareness of like, oh, okay, I shifted too much there because I dropped the yoga block, or I shifted too much there because I kind of like banged my hand on the floor, as opposed to like kind of stepping forward really gently. So that's definitely, that's like a big, it's also, we incorporate that a lot into our postpartum, and really in all of our training. Crawling is a really great way to teach that bracing in that quadruped position.
Yeah, I like that. That's a great one. And then even just practicing crawling your feet closer to your hands so your butt kind of comes up, but you're still maintaining that alignment. You're not tucking and rounding,
Yeah.
and then walking back out, like just playing around
Yeah.
with the crawl. They're great.
Yeah, there's lots of different options you can do. And you were saying just a couple of minutes ago about the breathing techniques. And I think that's important because I think a lot of people don't, the vast majority of people do not realize how they are breathing or are not breathing when they're working out. And again, this goes to like all populations of people, but specifically postnatally, that's really important to be able to, like you're saying, deal with the pressure. So like being able to cope with the resistance that your body weight is giving you, or the resistance that your weight is giving you, or just like the challenge of the movement, to be aware of how you're breathing and what's going to be a beneficial strategy for you. So for example, inhaling down into, as you come down into your squat, into the descent, and then exhaling to stand. And I think a lot of people are not aware that they are breath holding while they're doing that. And so, what happens? Can you give us like an idea of like anatomically what happens when you hold your breath when you're going through like that kind of functional movement?
Sure. So like for this abdominal canister, I always refer to it as like a pressure cooker.
Mm-hmm.
Okay. So we've got organs and gases and digestion. We've got pressures happening always in here. And this pressure cooker, we have a release valve to be able to exhale that pressure safely. If we hold our breath, we've cut off the release valve. So this pressure is still there and it's going to go to the weakest link. So
Yep.
that's what I tell people, depending on what's going on in your body. If you've got a diastasis, you've got some thinning and it hasn't quite healed back, it may come through that front abdominal space,
Right.
and you could potentially be at risk for hernia. Or the pressure could go down to your pelvic floor. It could cause leaking. It could cause that pelvic organ prolapse and disruption to the connective tissue there. Or it could go to your back. If you've got some spine issues, you could get some herniated bulging discs. So you've got pressure there, you want to manage it and release it safely. So that exhale is your way to be able to release it. And being conscious of it is one step, but then really being aware, having someone cue you of what you're doing, because we can think that we are exhaling, but a lot of times we will brace and breath hold for the hard part. And
Right.
then once we're past the initial lift, then we exhale. So it's
Yep.
really a matter of getting yourself engaged. If it's a slow, controlled movement that you can prepare for, get yourself engaged. Use that exhale to connect with the inner core. We've got it. Now I can hold that, contract that bracing, and I can breathe. And now my breath is freed up for the movement, for the task at hand. So then I can start my exhale. I've got my core and pelvic floor engaged. I'm going to start the exhale, and then I'm going to do the movement and continue it the whole time. So
Right.
rather than breath, hold, and then release.
Right. And then when you're talking about like more ballistic movements, so like for example, when we do kettlebell swings, we do what's called the biomechanical breathing match. And so it's a sharp inhale back into the hinge position as you're reaching the hips back and the bell goes back in between your legs.
Mm-hmm.
And then as you bring the hips through, it's a sharp exhale with the tongue against the back of the teeth. And that's to create the stability. So you're inhaling to create intra-abdominal pressure to create support for your back in the neutral position. And then that sharp exhale to create stability and lockout at the top. So at the top of your kettlebell swing, we often say it should be like the top of your plank. So at that top point of the kettlebell swing, when we don't also, just for sake of mentioning this, we don't swing above the shoulders. That's just not what we do Russian style kettlebell. So when we're swinging here, this is also then your plank. So if we were to tip you over at the top, that's the same amount of tension that you should have in your plank as in your kettlebell swing.
Okay.
So that like, and it sounds really stupid and it's very loud when we do it, but there's like a reason why we do it, right? So it's like the breathing changes when you throw in ballistics, when things are more high impact and they're quicker in the acceleration. So it helps your body to then respond a little bit more. So that's definitely like a step further down the line, postpartum, returning to kettlebell swings. It's not something that we introduce really within the first probably like 2 to 3 months postnatal. We really try to hold off on the ballistic movements so that you have those slow controlled movements, under your belt first, and then we progress to the ballistics.
Yeah. And that technique is great because you're tuning into the tongue. So we have these like lines and slings of connection through our core. And so you're using the tongue to create. So a lot of times we'll clench our jaw. So that's, jaw tension is closely related to pelvic floor tension because you're trying to create pressure, tap into that pressure system and engage the core with your jaw. So a much more effective and safer way is to use the tongue at the roof of the mouth that you're doing, and then using that sound. So if we have like higher pitch sounds, it it taps into our pelvic floor to be able to engage and to be able to activate it. And we can also use like lower pitch sounds to be able to open and relax. So you're kind of tapping into that activation sound and that quick exhale. The exhale, it's already automatically contracting. So you're just kind of tapping into that system and what's happening.
Yeah, definitely. And we can see, like, I definitely see when people really get that breathing technique down, you can see the match in their body. Like, their body automatically responds. When they're doing that quick exhale, you can see they're much more stable and it's much safer, I think, overall for their body to do that. And then, you reload the breath with the sharp inhale to reach the hips back and down again. So it can be helpful to start like very low volume and just doing like, 2, 3, 4 reps at a time. And then kind of increasing your volume. So it's like, when you're returning to doing hard style kettlebells, that's a big consideration. And then, so I know we have definitely people who will combine heavy lifting and like more like cardio, high intensity stuff. So for example, like, if you go to a HIIT gym where you do both things, or if you go to CrossFit and you're doing like barbell snatches combined with something like a box jump. Now I know because I was postpartum with my first doing CrossFit, and I was doing a WOD workout of the day that was deadlifts, heavy deadlifts. I think it was probably like, I don't know, like 165 or something, so it was like high rep deadlifts with box jumps. And I can remember I was probably at least maybe 9 months postpartum. And I was like, oh my gosh, I was like 5 minutes into the workout and I was like, I'm totally leaking and I can't control it at all. And so, for people who really want to return to those kind of activities, where there's a high demand on their pelvic floor, I think, I would advise them definitely to have that conversation with their coach and to say like, listen, I'm ready to come back, but I need to be like making these, adjustments or modifications. But like for women who are maybe like doing it at home, or they're maybe like, they're not comfortable talking to their coach about it, what's a good way to progress? And then on the other side of it, what's a great way to regress if you feel that that dysfunction, the prolapse or the leakage?
Yeah. Good question. So let me know if I don't answer it, if I didn't follow it the right way. But I think just hearing like the combination of the heavy deadlift and the box jumps, my mind directly wants to go to what was it? Was it the heavy lift or was it the box jumps? Or did the heavy lift fatigue you out so then you couldn't handle? Like if you had separated them, would you have been fine with one of them? Or like so
Yeah.
I would kind of like want to dive a little bit deeper and like assess what parts, maybe where are you breaking down, figure it out that way, and then you can modify it. So the box jumps, maybe the height is too much, maybe you're not coming down before you're jumping up, or maybe you're landing stiff, you're not absorbing that. So I would kind of look at what you're landing, what your technique is, what's your posture and your breathing strategies. And then same thing, breaking down that deadlift and seeing, what components could we modify to be able to get you to still do.
Oh, it was like 7 years ago. So it's much better now.
But yeah, that I think, being able to break it down and figure out what components, it may have been a combination,
Definitely.
and then separating them out might have been able to give a better answer.
I think a lot of times too, it's hard because you get caught up in, in the environment of the gym, in the hype, in the excitement, and the encouragement from your coaches, your well-meaning coaches of like, go, 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 and then like, a lot of times they're like male coaches and they just like have no idea what's going on in the postpartum body. And I'm talking like 9 months postpartum. Like this wasn't straight out of the gate. This was like after I had been exercising and I was like expecting, the same response from my body that I had gotten prenatally, which just was not realistic, in retrospect. But I think a lot of times when you get caught up in that moment and you're like, I really just want to do it. And then all of a sudden your body starts rebelling against you and you're like, uh-oh. So you don't yet necessarily have those breathing strategies, because you're just trying to get through. I think like most of the time when I did CrossFit, I mean, I loved it. But it was like, it puts you into survival mode. You're like, I'm going to get through this because it's a badge of honor to like make it through, the workout at, prescription weight and, not modify. But it really takes a lot of forethought to say like, okay, here's today's workout. Maybe instead of doing my box jumps, I'm going to be doing step ups instead. And I think that that's like an appropriate modification, but like also knowing that even 9 months down the line, like you may not necessarily be ready for all the things that you did prenatally. It's definitely a journey.
Yeah, and I mean, I think even like a year or so, I mean, I think you can still expect to not be at your 100%, but on your way. I mean,
Yes.
and yeah, the ego, I mean, I know it going in, and I still have a hard time to like fight it down. But yeah, really, just trying to be respectful to your body as you're going through these things, and the outcome, like you have to just you know like suspend that for a little bit.
Totally. And I think, it's just the constant self reminders, like whenever you're returned to exercise, whether it is 6 weeks postnatal or whether it's a year postpartum or whether it's further than that, just being prepared and, being ready to tell yourself like it's okay to not do exactly what I did before. It's okay to modify if needed. And it's okay to not feel awesome after a workout. Like if you did a workout and then, you've got some back pain after, like you need to do some recon work. Step back and
Mhm.
say, what was it? And have that conversation. If you have a coach, which I just think, I keep coming back to, is having someone specifically to talk to about your movements and to consult with is so important. It's so invaluable. It's definitely something that, if you can work together as a team, you're feeling this and you tell your coach, and your coach says, okay, let's look at that. Let's break that down a little bit further. Or, you go to your PT or your OT and say, hey, this didn't feel that right to me. And then you break it down and see the movement. The more support that you can garner in your postpartum journey, the better. Honestly, I think like women are going to be so much more successful if they are supported by someone who really genuinely cares about seeing them make meaningful progress, and not just about, dropping weight after, because that's a whole nother problem with the fitness industry. Drop your
Yeah.
baby. No.
Yeah. And knowing what your cues are. So if you are in a group setting, knowing, like, I mean, I think I did this when I was a kid. Like I can like go back to like when I was in dance class, because I was a really bad dancer. But like I always like really wanted whatever the instruction was, I was gonna do it like 110%. So I was very obnoxious with my dance moves. And then like the teacher would say, the teacher would like say a cue to somebody else, and I would hear it and I'd do it even more. So I was like even more over the top with this, whatever, I don't even know dance moves, but like my shuffle ball change or something. So like, and I still do it like even in a class. Like I know what my form is, but I'll hear the instructor cue somebody else, and then I'll do whatever it is even more, even though that's not what I should be doing. So just knowing what your cues are. If someone's saying to untuck, or maybe, okay, here's a really good one. So we hear so often that cue to pull your pubic bone towards your belly button. Okay. So basically what that's having you do is to tuck your pelvis, which
Mm-hmm.
we've kind of discovered we don't really want to do unless there's some specific move that needs an additional brace, but not in place of our brace. So we want to be able to, if we have to tuck, we want to engage the core first and then add that second layer.
Right.
But ideally, I mean, for our spine and for functional movements, we want to be working in a neutral, the best neutral for you individually, and strengthen the core around that. Now, sometimes that cue can be great if someone tends to have a very prominent arch, and they could move their pubic bone towards their belly button, and now they're moving towards a neutral.
Mm-hmm.
So that can be very appropriate for someone, but for someone like me who tends to be tucked under already as my go-to. If I were to do that, and I'm going to really get into my deep hip flexors, and I'm going to get tension, and I'm going to get my pelvic floor is going to be tight. I'm taking my glutes offline. So
Right.
knowing like what cues are good for you, or like, knowing that like, so to untuck, just to stick your butt out isn't a really great cue, because then you're not going to be changing anything else, and probably just straining your lumbar spine.
Yeah.
So being able to be in a class and know what's being aimed towards you or what's beneficial for you.
Yeah, absolutely. I mean, I think generalized cues for me as a coach are just like, I mean, like I use them sparingly. And if I need to cue someone individually, typically I will go up to that specific person and just have a lower conversation. Like I'm not gonna shout at someone from across the room. If they're not doing something correctly, in my opinion, I'm gonna make sure that. But it's you have generalized cues, but you're right. There's definitely people who are already, like, for example, with the kettlebell swing, to brace at the top, there's already people who are bracing so hard at the top that they can't lengthen the muscles to then get deeply into their hinge. And so because they don't have that, like, the contrast of like really hard gripping versus like that loading and relaxation, lengthening, then they're not being successful. So it's so important to like talk to each person as an individual, which I think is definitely an advantage of having a smaller group when you are coaching. We cap our classes at 8. Our postpartum classes are capped at 6. And so like to be able to address someone individually, and also knowing, what you need. So like if you know that going into a group setting, you're just going to be sucked into the hype and you're going to probably injure yourself, then like maybe that's not the right environment for you.
Yeah.
I definitely have had people who individually reached out to me who were like, I was in a group before, I seriously injured my back. And so I really want to like break it down and do, some one-on-one. And thinking about like one individual that I've seen recently, she did 6 private training sessions with me and we really broke down, different movements. And now she's successfully in classes without pushing herself so hard, and also knowing, what she needs to focus on as an individual. So I think that's a great advantage of doing, private training postpartum as well.
Yeah. And like you said, it doesn't take, you don't have to only be that, but a few good, like, establish where you're at and what your body's doing, can just go so far, I mean, that then you can join in and be, smart about it and be confident about it. And just, prevent that injury that's going to set you back for so much longer. So you just kind of keep moving forward steady.
Exactly. And don't be afraid to ask for help.
Yeah. It's not easy, is it? But we need it. We need support. We need a good support system. And yeah.
Yeah, absolutely. Awesome. All
All
right, well, I think
right. And
we covered a lot.
go
If we cover something that, someone had a question about, please let us know. Send us a message. We can always respond, in a post or in an Instagram story, whatever. If some of this has brought to light other things, we'll be meeting again next week. And so we'll be able to, address anything from this week's live feed that, maybe was left out.
Yeah. Yeah. I know we didn't get into like jump rope. I know jump rope is usually a big one. I know how to troubleshoot that one. Another one that good to wait towards that 12-week mark.
Yeah, I would
But
put lines as running.
yeah, it's a lot. It's hard. It's quick.
I don't enjoy it. But anyway,
It's hard.
mom loves jump roping. I don't know. She's like 67. She loves jump roping. I don't know.
Good for her.
Awesome. Well, thank you so much, Laura. I appreciate it. And next week, we're gonna be talking about? What are we talking about next week?
I don't know. We haven't talked about it, but we could do maybe prolapse. What do you think about prolapse?
Prolapse. Okay. Well, we just got a question. It's the biomechanical breathing match. The question was, what was the name of the biomechanical breathing you use with your postpartum clients? So we do, for postpartum, we typically start with diaphragmatic breathing, focusing on the diaphragmatic breathing. And then, as they progress, so you're inhaling to prepare, and then exhaling on exertion. Julie Weeb uses the blow before you go technique as well. And then I was talking about the hardstyle Russian kettlebell biomechanical breathing match. So those are all kind of different breathing techniques that we can utilize when doing different types of strength training.
And you want to be able to use your breath to your advantage, but also don't get so crazy hung up, because you need to be able to, you need to be able to have variance, and you need to be able to act quick sometimes. And maybe you're inhaling when you're reaching for your kid. And your body, with good practice and form and reinforcement, is going to be able to handle that if you've already got kind of done the building blocks. So.
Do the groundwork. If you take anything from this, it's do the groundwork first. Do like the nitty gritty, like focusing in on certain, very basic patterns like the breath. And then only then progress. Do not skip steps, because then you're gonna end up getting injured. I've seen it time and time again. I'm sure you have too. But take your time and just know what is your next step.
Yeah. And when you reel it back and make yourself get into the right posture and hold it, and use the right breathing and use the actual muscles that you're intending, you don't crazy exercise move. The most easiest exercise can be really challenging when you make the right muscles do that job. So just being aware of when you start to compensate and just do the movement versus the actual work.
Yeah, absolutely. All right, awesome. Well, we will talk next week about prolapse. Maybe we'll touch even a little bit on that, about bladder health as well, because I feel like that ties in pretty well, depending on what kind of prolapse you have. But if anyone has any questions ahead of next week, please let us know. Send us a DM, either one of us. Otherwise, we'll be posting this for playback whenever you are not being bothered by your children. I know for most people that's after 8 o'clock. So yeah, so awesome. So thank you so much, Laura, and we'll talk next week.
Awesome. Have a good one. Bye. Happy New Year.
Happy New Year.